will be doing my IV push and IV piggyback competency today. One of my medicines I'm doing is digoxin, so I'm going to go ahead and do that IV push, and that's what I'm going to do first. So I will come in, I will wash my hands, I will compare the MAR to the doctor's order. Once I do that, I will check the MAR with the doctor's order. We're going doing dig. We're doing the 0.5 milligrams IV push. We're going to do that at 6 o'clock. And once I work up my drug problem and the weight and everything, I'm doing 1 milliliter, and I will be giving dig, 1 milliliter undiluted, or 4 ml of SWFI or normal saline or D5W over 5 minutes. So once I do that, I will come in, I will try to make sure if it's a safe dose or not. So adults and pediatric patients over the age of 10 will get 8 to 10 micrograms per kilograms. And this will be a weight problem, so I will have to have my dose to determine if it's a safe dose. And once I work that, it is a safe dose. So once I see if it's a safe dose, dilution, that will be undiluted or over the 4 ml, just like I stated just a few minutes ago. And the rate of administration will be 5 minutes. So I'll have to give 1 ml of dig over 5 minutes. So once I do that, I take my MAR, done with the doctor's order, I take my MAR, and I come in and prepare my medicine. So I will draw up first I will clean the top with my alcohol, put on gloves, clean the top. I will go ahead and draw up my 1 ml. Okay. Once I drop my 1 ml, I will go ahead and safely recap my needle. Then I will go ahead and label. I will do the dig, the patient's name, the amount, which will be 1 ml. I will be doing an IV push, and I will be giving it at 6 o'clock. I will go ahead and label my medicine and everything before I go in the room. Then I will take my MAR. I will take an alcohol prep, and I will take this in the room. And I also, like I said, I just looked, and this can be given diluted, and dig is compatible with what's hanging, and what's hanging is D5. So it is compatible. So once I come in, I will introduce myself to the patient. I will explain the procedure, make sure everything is patent, there's no redness, patient is fine, 2 identifiers. Once I do that, I'll wash my hands, put on gloves, then I will use the port that is closest to the patient. Since D5 is hanging, then I know it's compatible. So what I would do is come in, after I explain the procedure, I will check the patient's armband. I did the 2 identifiers. I will make sure this is patent. The tube is running good. There's no kinks or anything in the tube. Then I will go ahead, I will clean this. I will go ahead and pinch. Because since it's compatible, I just pinch. I will go ahead, remove my medicine. Everything is still sterile. I will go ahead and hook it together. And I will do the push-pull method, and I will make sure I administer my dig over 5 minutes. So I will push-pause over 5 minutes. So I'll have to make sure my patient gets the medicine over 5 minutes. Once I finish, I unhook my medicine, I unclamp my tubing, I discard of everything, I check the patient, I make sure everything is patent, no swelling, lower the bed. Then I will come back and I will document everything, the route, what I gave, what it was duly with, just document everything. Patient is fine, no reaction to the medicine. Okay? That will be my IV push. Now I'm going to come over here and I'm going to do my IV piggyback. Okay? And with my IV piggyback, I am giving Sir Flaxone 1 gram every 12 hours with normal 100 mLs of normal saline, normal chloride. So first thing I will do, I will come in, I will wash my hands. I will make sure, compare the doctor's order with the MAR. Then I will come over here, go to the cephaloxime, okay? Usual dose will be 2 grams to 12 grams every 24 hours, and I'm only giving 1 gram every 12 hours, so it is a safe dose. You dilute this medication. Each dilution of powder with 500 milligrams per 1 gram or 2 milligram must be reconstituted with 10 mLs SWFI, D5W, or normal saline, or any compatible. And then you also do the 500. You will dilute with 50 to 100 milliliters that is compatible. So I'm going to use, this is going to be my 100 milliliters. That's what I'm going to use, and it is compatible with my D5. And also, I will come over here and do every single dose over 30 minutes. So I will have to, once I work my problem up, I will have to give 33 drops over 30 minutes. So then I will come over here, the right dilution, safe dose, everything is good. I will check for allergies with the patient. Then I will come in, check the patency of the bag, the color, I will check the date. Everything is good with that, no kinks, the color is good. So then I will go ahead and label my medication. And that's gonna be, okay, medication, I'm giving 1 gram per 12 hours. It's 100 milliliters. Okay. Okay. Then I will go ahead. I will label my bag, and then I will go ahead and start getting my other equipment together while I'm in the nurse's station. And I want to make sure I keep this as a sterile technique. Okay. And I will take this and go ahead and prime my bag while I'm in the nurse's station as well. So I will take my medicine, I will take the MAR, and it is labeled, and I will take my alcohol. I will take this to the patient's room. I'll ask the patient about, come in, I will wash my hands, put on gloves, I will introduce myself, I will explain the procedure. I will also check the armband, 2 identifiers, ask the patient is he allergic to allergies. Then I will come in, check the MAR. Okay. Once I come in, I will check the MAR, make sure that MAR is compatible. Then I will come in, make sure my tubing is running good, my D5 is W is running. Check the patient's IV site, make sure the IV site is patent. Everything is good. I will then lower the bag. Once I lower the bag, everything is patency and running good. Then I will go ahead and hook this, because this will have to be lowered. And then I will go ahead and hang this as well. Okay? I explain the procedure. I check the patient's armband, use the 2 identifiers. IV site is good. I will put on my gloves. Everything is running good. This is patent. So I will use the port closest to the IV. I will clean that port. Once I clean that port, First, I will go ahead and prime this down. Okay, and it's prime. Okay, clean that. Okay, I'll put that up. Then I will use the end that's closest to the patient to set my drop factor. But in this case, I can't get the drop factor to work. We couldn't get the drops to go in the patient, so I would have to use this and drop it in the trash. So what I would do is I will let this run, my 33 drops over my 30 minutes. I will let it run. Then when I come back and check the patient, this is what I would do first, because it's not gonna let me run into the patient, so I'm just gonna go ahead and do my drop factor. Because what you would normally do is let it run over 30 minutes and then come back and check on the patient. Okay? So I got it primed, everything is good. So now I'm gonna do my drop factor, and I do 33 drops per minute. Okay? So I'm gonna let it drop just a minute. And then a little fast. Let me slow it down just a little bit. Okay, let's Okay, I did 33 drops over the 30 minutes. So what I will come back in, once I check my patient, everything is fine, my patient is fine, then I will come in, I will discard this in the trash. I will then cook my D5 back up, and I will go ahead and set the rate back to the rate it was. Once I set the rate back, I will check on my patient, check the IV site, make sure my patient is comfortable, put the bed in lowest position. Then I will actually come back here and I will document the medicine I gave, the route, the rate, the amount of dilution, and make sure the patient was comfortable, no reactions and no allergies. And that concludes my video.